everybody, this is She, and today I thought I would come with a quick and short little vlog about my career choice and my field, which is speech language pathology. So I'm going to talk about what it is, and secondly I'm going to talk about why I chose it. And so the personal aspect to this video I think is very important, because advocacy for the field is a great tool, being that I find that a lot of people don't know and are ashamed to say they don't know what speech language pathologists do. I never knew. I went through my whole college career not knowing what a speech language pathologist did, and even being in this program I've learned just the breadth and the depth of the field, considering that, you know, we work in different settings, anywhere from early intervention settings all the way to hospitals, to skilled nursing facilities, to nursing homes, to schools, and mostly, you know, people associate us with working in schools, but they don't realize that, you know, we also work with swallowing disorders from any age range. So I will give you the official textbook definition, and this is taken from the Scope of Practice of Speech Language Pathology document, which you can find on the American Speech Language Hearing Association website, which is asha.org. And basically it just talks about the practice of speech language pathology, the scope of practice, the functions, and it sets up a framework really, so that we know, you know, what our field entails and what it doesn't entail. So basically it says the practice of speech language pathology includes prevention, diagnosis, habilitation, and rehabilitation of communication, swallowing, and speech disorders. So basically what that means is that we play a part in prevention, and so you know, you may easily relate that to, you know, a young child who has a condition, who is born with a condition. It may be autism, it may be cerebral palsy. So we already know that those children, they will already have certain difficulties. And with autism, you know, you have that spectrum, so it can vary. They can be low functioning to high functioning. So, you know, their speech and communication skills are going to vary depending on the child. But, you know, we want to prevent them from having, basically, we just want to enhance their communication, and we want to get them to a level where they're being effective communicators. We don't want them, you know, like I said, to not be able to reach their potential. So that's what a speech language pathologist does. Basically, we help foster and encourage communication. If we're talking about swallowing disorders, I feel like that does apply to all age ranges, but mostly medical speech language pathologists, or someone, like I said, who's had training dealing with learning how to treat and to evaluate swallowing disorders. That would be basically a medical speech language pathologist. So like I said, it just covers a whole lot of settings, a whole lot of populations, anywhere from, like I said, 0 to adults, and also with many different disorders. And I'm not going to sit here and list them, but basically, you know, in children, you know, we have a lot of the common disabilities, severe disabilities as well. We have children who don't necessarily speak at all, who may use an iPad or another communication device that has voice output. We will be training them to use that to be able to request and make their needs known. If we're working with stroke patients, you know, they may have aphasia, they may have dysarthria, they may have a whole lot of conditions that are secondary to what their initial reason for being in the hospital is. And so, like I said, I feel like with this field, like, you will never get bored. You know, if you're tired of working in a hospital, you can try a different setting, you can try a different population, you know, given that you are willing and open to doing that. So let's just share quickly why I chose this field. I think that it was really something that I almost feel like I stumbled upon, but it wasn't an accident. And having graduated with an English degree, I've always been a lover of languages and literature and just communication in general. I never knew what a speech language pathologist was. Never came in contact with one in schools. I wasn't a second language learner in English as a second language learner, but I was basically, I guess I learned English really fast, and I transitioned into an English class really easy, so I never had difficulties, that were thought to be, delays in any sense. And I just started meeting people in the field, and I came across 2 girls in my church who were young professionals, talked about their field and how rewarding it was, how I should look into it. It was a very scary decision to make, but I feel like things were happening in my life that just kind of led me to that direction. Whereas I got laid off from my job, and just, I had finished my bachelor's degree, but then it's like I didn't really know how to get into publishing, so that it would be profitable for me. And I think that it was just a way, like I said, where I was being set up for it to take that risk and go back to school. And so I did it. And graduate school was probably one of the hardest things to trying to get into. One was probably one of the hardest times, just with all the emotion and all the work that goes into that, and just knowing that me myself with my GRE scores, like I was just very concerned about how I would measure up, being that the programs are so limited, so small, and the applicant pool is so big. And I'm so glad that I'm able to see this path through. And I think that the greatest thing about speech language pathology, if you don't remember anything else about the video, is that it's a science and an art. So there's very technical things, that we do learn, and we do learn about the speech mechanism, and we do learn the science behind it. We do learn about pathologies, and we learn very technical things. But then the art comes in with therapy, how you structure your therapy sessions, how you connect with your clients, how you connect with your patients, how you connect with your students. And all of that really requires so many people skills, some counseling skills. It requires you to be like this person who basically can connect with whatever population you're working with, and can motivate them, and let them see why they should work with you. Because if you find somebody who doesn't want it, then you won't see any outcome. But I think that I chose this field. I think it's a great fit, and I would encourage anybody out there who is pushing to get into grad school, who has been rejected, who has had to experience that pain. I would continue you to push through, because you are so needed and so necessary. And the risk is great. You're putting yourself on the line. That's something that unfortunately you have to experience. But just because you're delayed does not mean that you're denied. And I think that it's easy to get discouraged, and it's easy to see people who maybe they didn't deserve to get in, or you trying to understand what it is that these schools want. But I think if it's something that you really, really want, and you really see yourself succeeding through, then it's definitely worth it. And I don't think that you should let fear hold you back, because I surely didn't. Thank you, guys.